All right, knocking on the room, entering, shutting the curtain for privacy, inspecting the room for any environmental safety issues, and then I'm gonna wash my hands. Rub here. Hi.
Hi.
I'm Jennifer. You must be Raymond.
Yes, I am.
Okay. Do you go by Ray or Raymond?
Ray.
Okay. I'm just gonna check your bracelet here for your name and date of birth.
11/10/79.
All right, perfect. And what you come in to visit us today for?
Do my annual checkup.
Okay. All right. Sounds like a plan. All right. So for your annual checkup, I'm just gonna go over some interview things, and then do a little physical assessment on you. I'll be looking at your neuro as well as your musculoskeletal. I'll listen to your heart, listen to your lungs, and then I'll lay you down and we'll listen to your abdomen, make sure everything's going okay there.
Mm-hmm.
All right, so let's start off. First of all, do you have any past medical history significant for any high blood pressure, diabetes, stroke, cancer?
Nope.
Okay. Any hospitalizations
Nope.
in your life? How about surgeries?
Nope.
All right, when looking, this is a little family history. I just want to generalize for like the last two generations. A lot of G's. Looking at your grandparents and your parents. Any significant there for any like stroke, hypertension, high blood pressure?
Nope.
Cancers of any sort?
Nope.
That's both maternal and paternal.
Yep.
Okay. Do you take any medications?
No.
Over the counter?
Nope.
Prescriptions, supplements, herbals? Okay, how about allergies? Any?
Not allergic to anything. Really.
Okay, no foods, medications, latex, environmentals like pollen or anything like that. Okay, how about your immunizations? Are they up to date, including your COVID, tetanus?
Yep, I got the 3 boosters.
Okay, how about flu? Did you get your flu shot this year?
Yes, I did.
All right. Do you drink?
No.
Do you smoke?
Nope.
Any recreational drug use?
Mm-mm.
Okay. This question about safety. Do you feel safe at home?
Yeah.
With your family and your friends?
Mm-hmm.
Okay. How about work? Do you feel safe there too?
Yep.
All right. How about your neighborhood? Do you feel safe where you live?
Oh yeah.
Okay. This is just a quick little other safety little assessment. Do you drive?
Yep.
Okay. Do you wear a seatbelt when you drive?
Oh yeah.
Okay. Do you ride a bike or a skateboard or anything like that?
I ride a bike.
Okay. Do you wear a helmet when you do that?
Oh yeah.
Okay, that's good. So this is just going to be a little assessment overview of how I see you. Your posture is sitting upright in this chair. Your movements and dress are appropriate. Your hygiene is clean. You're alert. You're oriented to yourself, the situation, place, and time. And your voice is the rate and rhythm are normal, and no repetitions in any of your thoughts, ideas, or words. Okay. That's all I have. Do you have anything else to add to that at all?
Nope.
No? All right, I'm just going to go ahead and grab a set of vital signs on you. I'm going to do your blood pressure, your temperature. Let's count your respirations and your pulse.
Mm-hmm.
Okay. All right, I'm gonna do a 2-step blood pressure on you. A little different than probably what you're normal to, but I'm gonna end up inflating this cuff 2 times on your arm, but I'm gonna let it relax in between. I'm just gonna feel for your brachial pulse, and once it dissipates, I'll go about 10 above that, and just make sure I have everything here with me. Yes, your arms. Alright, it's dissipating around 26-ish, so I'll go just a little above 130, which is like about 10 above. I'll let that sit for a minute. Can you place this under your tongue, please? All right, thank you. Just gonna feel your pulses here. I got your pulse is 76. Your respirations are 16. Pulse is equal bilaterally. Mid grade is a 2+. All right, temperature 98.1. Go ahead and finish blood pressure. Pumping this up to about 136-ish. It's 124/78. Blood pressure. Take this off. Blood pressure is good. Everything's good. Okay. All right. So now we're just gonna go over some of the physical things of this exam. I'm just gonna look at your head, your eyes, your ears, your nose, your mouth, and then I will move on to listening to your sounds and then testing some of your cranial nerves. Okay. So first thing I'm looking at is your head. It's symmetrical. If I touch it, just tell me if you have any tenderness at all.
Nope.
All right, shape is normal. Oh, it's in my pocket. Okay. Your hair, go ahead and look down for me, please. Hair is soft. Texture is normal, soft. There's no balding patterns. Actually, he's got pretty thick hair. And no signs of any infestation or bugs. So that's good. All right, I'm just gonna feel here real quick. Do you have any tenderness here? No tenderness?
No.
Okay. So I'm just looking at your nose real quick. There's no evidence of tenderness, displaced cartilage or bones. I'm gonna have you look up for me. Okay, no evidence of any deviation. Looking at your ears, are symmetrical on both sides. I'm not seeing any deformations or any nodules. Appropriate color and appropriate temperature. Just gonna go ahead and sneak a peek in each. Just look inside. All right, and then I'll have you look over here. No evidence of any drainage. All right, so now I'm just looking at your eyes, your eyebrows, your eyelids. I don't see any tremors. I don't see any swelling. Looking at your eyelashes. Negative for ectropion or entropion. I'm just gonna have you look up for me real quick. Okay. Conjuncti is pink and smooth look and moist. I'm gonna have you open your mouth. Perfect. Looking at the gums, the buccal, the mucosa, pink, moist, no lesions. Looking at the teeth, I just see normal wear. I don't see any caries, notches, broken, loose, or missing teeth. Go ahead and say Looking at the tonsils are paired, I would grade those as a 2, and tongue is pink and moist. Okay, that's done. So now I'm just going to go ahead and I'm going to feel around your face for your lymph nodes, looking for any enlargements or abnormalities of those, okay?
Mm-hmm.
So first is bear with my pronunciation because I'm not very good at this one. Your pre-auricular, going back to your post-auricular, moving back to your occipital, moving to your submental, submandibular, tonsillar, anterior cervical, posterior cervical, moving down here to your supraclavicular. There's nothing there. There's all normal. No enlargements. Okay, now we're going to test your cranial nerves.
Mm-hmm.
Okay, just making sure I can see this. All right, now cranial nerves 1 and 2 are both deferred. Cranial nerve number 3 is with your eyes. Mm-hmm. I'm just going to get my pen out here again. I'm going to have you follow my pen in some different directions. Okay, so just look at the tip of my pen and follow it with just your eyes. Okay, and then I'm going to have you follow the pen over here. I'm going to bring it toward the tip of your nose and just follow it, okay?
Mm-hmm.
Okay, and then I'm going to have you just look straight ahead. I'm going to put a little light in here. Just looking for some constriction. All right. Pupils are equal, round, reactive to light, and accommodating. Cranial nerve number 5 deals with touch. I'm going to go ahead and touch your face lightly. Let me know that you are feeling that. So I'm going to go around your forehead to your cheeks, okay? You feel that?
Mm-hmm.
Right.
Yeah, feel it.
Clench your jaw. Go ahead and try to open your jaw against my resistance. Okay. Number 7 is facial expression. I'm going to have you smile, frown, puff out your cheeks, and clench your eyes. All right. Number 8, I'm going to just rub my fingers. I'm going to have you close your eyes, and you're going to tell me which ear you hear.
All right. Left.
Okay. All right. And this one?
Right.
Okay. Number 10, I'm going to have you, or 9 and 10, I'm going to have you swallow for me and say ah. All right. In accordance to your ah and your general speech altogether, there's no evidence of hoarseness. Number 11, cranial nerve. Shrug your shoulders for me. Okay, down. Now shrug against me. Okay. Turn your head both ways. Okay. Now turn your head toward my resistance. And the same with the other side. Okay. Cranial nerve 12 deals with your tongue. Have you stick it out side to side. And then move it up and down. Okay, perfect. Cranial nerves 3 through 12 are all intact, no abnormalities or difficulties. Okay, let's see. Would you be okay removing your shirt?
Yeah.
Okay. All right, I'm going to go ahead and we're going to listen to your heart.
Mm-hmm.
I'm going to listen to it in 5 different places. First, I'm going to start with the aortic valve, and then I'm going to move over to the pulmonic, tricuspid, Erb's point, and then your mitral.
Mm-hmm.
Listening to each location's S1 and S2 sounds. Okay?
Mm-hmm.
All right. First sound is going to be your aortic valve. moving over to your pulmonic valve. Down to Erb's point. Okay. Down to your tricuspid. And over to your mitral. Okay. All S1-2 sounds are all a normal rate and rhythm. Let me see your hands. Just going to be looking at your fingernails for capillary refill. Okay. And some skin turgor. Okay, capillary refill is less than 2 seconds. Skin turgor is negative. Alright, I'm going to have you look at your legs real quick, please. Alright, looking at this leg. Just looking for some edema and general appearance. Okay, this one. Same with this one. Okay. Let's see. Feeling for your dorsalis pedis pulse. Right there. Those are equal bilaterally. I grade those as a 3+. Your edema I would grade, we'll just say a 1+, a little sock indentation. Okay. So now I'm going to listen to your lungs. Okay.
Mm-hmm.
So I'm going to listen to your lungs. I'm going to listen to 8 points on the front, 8 different points on your back, and 2 points laterally on each side.
Mm-hmm.
Every time that I ask you to take, that I acknowledge, just go ahead and take a deep breath in and out, okay?
Mm-hmm.
And I'll be doing that each time I move my stethoscope around.
Okay.
Okie dokie. All right. Breathe in and out. Breathe in. 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 Okay. Under your armpit hair. In. Okay. In. Okay. This side. In. Okay. And in. Perfect. All right, I'm going to have you turn the other way now. I'm going to listen to the back 8.
All right.
Yeah, that's good. Same scenario. Breathe in and out. Ready?
Mm-hmm.
In. One more time. Good. Perfect. All right. No evidence of any adventitious breath sounds. Okay, actually turn it again one time. I was going to test your chest expansion real quick. Breathe in for me. Out. In again. All right, chest expansion is symmetrical, so we're good there. Now I'm just going to look you over here real quick. Just looking over the skin of the back, the chest, and the arms. Okay. Okay. Alright, I'm going to go ahead and test your reflexes. Just going to use the bell on my stethoscope because I don't own a hammer. Ready?
Mm-hmm.
Alright, perfect. I would see those are about a 3+. I like it. Alright, I'm going to have you stand up for me. We're going to do a couple of tests. I'm going to test your accuracy of movement. Then we're going to do a Romberg test. Romberg test for balance.
Mm-hmm.
And then I'm just going to have you just take a little walk here and there. Okay? Mm-hmm. So now we're going to, you can't see our faces. So no. So you can see our faces. All right. So accuracy movement. I'm going to have you put your hands up. Touch your nose. Touch your other nose. Both. Okay. Hands on up. This is going to be for your rapid movement test. I'm going to have you go back and forth, flop like a fish. Okay. All right. Stand back up. All right. Put your hands down at your sides. I'm going to have you stand there for 30 seconds, and I'm going to watch you for movement.
And close my eyes.
Yep. And close your eyes. Close your eyes. Arms down. There you go. Perfect. And stand for 30 seconds. All right, you can open your eyes. No evidence of any swaying. I would say your Romberg test is negative. I'm just going to have you walk across the floor here a little bit and then walk back. Gait is symmetrical and normal and rhythm. All right, so for this test, we're going to be looking at your musculoskeletal. We'll just leave it, it'll be fine. So we're going to do different, I kind of want to pull you up here a little. We'll move it up and then we'll move it down. There. Okay. So we're going to be looking at your joints and no pain still?
Nope.
All right, good. So the first we're going to do is we're going to look at your cervical. I'm going to have you, we're going to do flexion, extension, bending, and rotation.
All right.
So we're going to look down for flexion, up for extension, side to side, bending, and then rotating. Good there?
Mm-hmm.
Okay. So shoulders. Mm-hmm. We're going to do flexion, extension, abduction, adduction, external rotation, internal rotation. Okay. Shoulder or elbows. Flexion, extension, okay. Wrists, we're going to do flexion, extension. We're going to do, supination, pronation. All right, fingers. We're going to do flexion, extension, abduction, adduction, and then thumb opposition. Okay, let me fix camera. It's gonna do this down a little bit. Okay. So for our hip, we're gonna do both. So we're gonna go, this is flexion, this is extension, abduction, adduction, external rotation, internal rotation. Okay. Flexion, extension, abduction, adduction, external rotation, external rotation. All right, knees. flexion, extension. Okay. Flexion, extension. All right, and then our ankles, dorsiflexion's up, plantar flexion's down. Next one. Dorsiflexion up, plantar flexion down. And then our feet, we're just going to do inversion where we're going to bring them in, and eversions bring them out.
Okay.
So in, yep, out. Okay. Inversion and then eversion. Okie dokie.
Strength first.
So I'm going to go ahead and test your strength now. We're going to start in your arms. Okay, I'm going to push against. I want you to go against me.
Okay.
So go there, pull back. Okay. You see your fingers or your hands. Grip my fingers hard as can. Okay. I'm going to push forward, you push back. All right. And then, okay. Up and back. Okay. All right. I'm going to have you, actually, I'll look at your back again real quick. So contour a back. There's no any evidence of lordosis, kyphosis, or scoliosis. Looking at his legs and his back and his arms and chest, as I did earlier, no evidence of any lesions or deformities. Skin's of normal color and temperature. Okay. And I did your skin cover, so we're good there. Go ahead, I'm going to have you lay down. All right, laying down, I'm going to, so now I'm going to listen to your abdomen. I'm going to listen to each quadrant for a minute apiece, starting in your right lower quadrant. You're still no tenderness or any pain in your belly or anything, okay? Abdomen curvature is flat. No evidence of any skin lesions or deformities or pulsations. Let's go ahead and take a listen. When was your last bowel movement?
A couple hours ago.
Okay. How about urinating?
Yep.
You doing okay peeing? Normal?
Yep.
No pain?
Nope.
Okay. All right. Now listen into your right lower quadrant for a minute. All right, move into the right upper quadrant. Okay, moving over to the left upper. And then down to the lower left quadrant. All quadrants auscultated. Bowel sounds are normal active. Oh, don't get up. No, don't get up. I gotta finish my strength.
Oh.
I'm working down. Alright, and the last part of our strength test, I'm going to have you pull up on your toes when I push down, and then push on them with the gas pedal, okay?
Okay.
So down, or so pull back. Alright, and push forward. Okay. And then looking here for your cap reef. Cap refill is less than 2. Perfect. Okay. You can go ahead and sit up now. Is there any questions or anything I can do for you right now? Any comments, concerns?
No, there's nothing you can do for me right now.
Okay. Well, your doctor will be in shortly.
What was my doctor's name again?
Dr. Lamason.
Ah.
Yes.
Okay.
Yeah, that's my brother.
Mm.
So, okay. So, but he'll be in with you here shortly, okay?
All right.
All right, you have a good day.
All right.
All right, bye-bye. You can put your clothes back on too. All right, bye.